Next, we have Christine Lavelle from The Sun.
Thank you, Health Secretary. The First Minister stated this morning that the care home death rate in England and Wales may have been underreported. But is it not also the case that Scotland's care home death rate has been underplayed, given the number of excess deaths recorded in care homes over and above those which are registered as being COVID-related?
So I don't believe that Scotland's numbers are being underreported at all. National Registers of Scotland, which of course is an independent organisation that works to very high professional standards, publishes every week all deaths in Scotland, including those that are related, either confirmed COVID deaths or where COVID is a feature on the death certificate. And it also sets out the location of those deaths and additional information in terms of excess deaths. So I am confident that the figures that are published weekly in Scotland are accurate and are not in any sense underreporting at all. Those figures are concerning, and they are concerning to all of us all of the time. We know, and we don't say this glibly every briefing, that every single one of those deaths is a loved one lost and that people are grieving. And the whole issue around excess deaths, I may ask Jason to say a bit more on that in a moment, is actively being looked at to try and understand why there are the level of excess deaths that there are and what are the contributory factors to that. This isn't some kind of competition between the nations in the United Kingdom. It matters to everyone, and we need to understand for now, but also for our future work, what are the contributory factors there and what more might we need to do in the immediate, but also the medium and the long term to get Scotland and Scotland's health into a better place. Jason, do you want to add to that?
So excess deaths is a really difficult statistical concept and a difficult piece of data to gather. We use it for things like special things that happen. So if you imagine there was a heat wave and we looked at a 3-month period around Scotland and compared it with 3-month periods for the last 10 years, and we would calculate 74 people died in addition to what is normally expected during that period. And we wouldn't have particular diagnoses attached to them. And we would then suggest, statistically, those 72 people had died as a result of the heat wave. So it is not an exact science. The excess deaths for this disease are a data challenge for those not allocated with a Covid-19 diagnosis. Remember, in Scotland, everybody who a medical practitioner puts on the death certificate anywhere that Covid-19 was the main or contributory cause, they are counted in our mortality statistics, the weekly mortality statistics. The excess deaths number are not yet robust enough to compare country to country. The numbers I see in the media today, I don't think you could compare those countries, and as the Cabinet Secretary says, I don't think it's yet time for that comparison to be made. In time, there are European public health bodies which will look at excess deaths across the whole of Europe, and globally there will be other organisations that look at that. Scotland has some things in Scotland that make it unique. It has deep-seated health inequalities. It has real challenges, particularly in the west of Scotland, with socio-demographic drift and disease. So like every other disease, COVID affects the poor more than the rich. So in Scotland, that will come through in our statistics, I have absolutely no doubt. So I think in time, that excess deaths data will be very, very helpful for us.